what is the prevailing dominant attitude among doctors when weighing up the benefits versus risks associated with, for example, treatment of AZT for patients diagnosed with AIDS?
Yeah, AZT has its side effects, right? Yeah, it has anemia, yeah, like you said, pancreatitis. Many side effects, but still, it's treating the patients, right?
It's treating them, but
they are getting better.
Is it alleviating immune deficiency?
It's not oh yeah, it could
or
be
is it causing it?
It's causing, yeah, pancytopenia and all, reduction in all the cell lines, but weighing at least it prolongs life,
Well, is there a study that has been done that shows that?
Not that I know of.
Well, there was a study called the control study that actually showed that patients on the drug compared to the placebo group did worse off. And many of the patients required blood transfusions to compensate for the anemia caused by the drug.
Why cannot recording that? You should edit some of those things.
Considering you're in your third year as a medical student, and the conversations we've had debating alternative causes of AIDS, does it seem plausible to you that the virus known as HIV is irrelevant in causation of AIDS?
Okay, after talking to you, I realized so many things could cause AIDS, because AIDS in itself is not a disease. It's just a collection of symptoms, signs and symptoms. So I wouldn't think HIV could be the only cause of AIDS, because like you were saying, there is immune deficiency, there is maybe cancer chemotherapy, there is malnutrition, and all those factors that come along, even with IV drug users. But mainly here in Africa, it could be malnutrition, given the fact that it's not only HIV that can cause that, that syndrome of AIDS. It's not only HIV.
And if it's not the only factor, how many factors are taken into account by the 6,000 AIDS NGOs operating in Uganda, claiming to fight AIDS?
Okay, I don't know so many, but the few I know, I believe they just take one into account. HIV, AIDS, yeah. Because even a question can come up and it's like, what is the cause of AIDS? And naturally, even a health worker will tell you HIV.
Does that question come up?
Yeah, it can. What is the cause of AIDS? Acquired immune deficiency syndrome? Yes, it does. It comes up. And if he's supposed to explain to a layman, he has to say it's this virus, maybe he quotes it nice, as in so that he can understand. The layman can understand.
Yeah.
So they don't think about malnutrition can cause that that syndrome of acquired, because it causes immune deficiency. CD4s, or the immune system, the immune cells. So they don't take anything else besides HIV into account. That's what I believe from what I've seen around.
Would you say that malnutrition is a serious problem in Uganda, even though there seems to be so much food around?
Malnutrition is a serious problem in Uganda, yeah. Despite there's so much food. Back where I study, there is plenty of food. It's the land of milk, honey, everything, you name it. But you still get patients with, you still admit patients into the rehabilitation ward, to rejuvenate what is it called? The body, to get back the person to their normal weight for age and a height for age and all. But it's ironic how they how malnutrition is common there. Maybe it's because of education. Excuse me. Because of education, like people don't have a clue.
They mean the food's available, but they don't know what to eat.
Yeah, the foods are available, but they don't know what to eat, in which amounts. They don't. Yeah.
And what would be the reaction among your lecturers to hearing you speak or answer your tests as if HIV is not the cause of AIDS?
Reaction? They would be very furious.
Furious?
Answer my questions as in like in a test, in an exam, or in like
in a test.
In an exam. I would definitely fail. Unless I'm in class. You know, they give room for, you know, for argument and explanation. But in an exam, you know, I didn't invent them, as in I didn't invent the whatever causes AIDS and what. Yeah, so I'm expected to, you know, not forsake my, you know, my elders' brains.
Yeah.
Otherwise, I'll be in for a rough time. Yeah, that's what I think.
You refer to the setting of a doctor faced with the dilemma of having to be seen to encourage the patient to continue taking the treatment,
because
or die.
No, the patient comes to you when they want help. You know, even if you know the side effects, even if they know the side effects, they can't tell you all of them. And when, like, of course, they can tell you some that you can easily see, and when you see them, you have to come back to the doctors. But there are some, like pancytopenia, a patient wouldn't know it's happening to them. But if it's diarrhea, they know it's happening, so they would, you know, they know that's troubleshooting, so they come back to the doctor. But a doctor wouldn't. Sometimes they don't say all because they expect this, they expect it to happen, but you came to them, you wanted help, you wanted to get better. How can I give you my drug and be the one to commit suicide? How can I give you a drug and then start talking, you know, negative about it? So much negative outweighing the positive. I can't, even if I know it's not easy.